Hi, my name is Matt Law. I'm a health insurance broker here at Health Benefits Associates, and today we're going to talk about the latest update here in Nevada in healthcare, which is what is going on with Carson Tahoe Hospital, Carson Medical Group, and their contracts with Hometown Health and Senior Care Plus. Now, before we dive into the video, I want to make sure that you know that this is our informational hub, our YouTube channel. If you like to stay up to date with what's going on here in Nevada, I recommend that you subscribe to our channel so you can stay up to date with any updates we have here in Northern Nevada and Southern Nevada. Now, I'm also going to flash my contact information here on the screen so you can contact me directly via email or phone with any comments, questions, or concerns. We have offices here in Reno, Sparks, and Carson, and we're more than happy to help with your healthcare needs. Now, from a 10,000 foot view, there's a lot going on in this conversation, but nothing to do as of today. Carson Tahoe Hospital is a hospital located in Carson City, and Carson Medical Group is one of the most popular medical groups in Carson. Hometown Health and Senior Care Plus are both local insurance companies here in the Reno area. And I hate to say it, if you've never heard of these two insurance companies, you probably don't live here in town. These two insurance companies cover most Northern Nevadans on one of their individual and family, small, or large employer plans. They also do Medicare Advantage plans through Senior Care Plus. Now, if you're insured through one of these insurance companies and you've received health care at one of the medical groups we talked about, you've probably received a letter from the insurance company. I'm going to put it here really quickly on the screen. It's a little hard to read, but you can always call us or email us if you want to receive a copy of this letter. Basically, the letter discusses how the two groups, Carson Medical Group and Carson Tahoe Hospital, along with their affiliate provider groups, are currently in a contract conversation with Hometown Health and Senior Care Plus. Now, what does that mean? That means that there are two potential answers to this. One, at the end of June, all parties come to an agreement and your coverage remains in network moving forward. And there's no change to your health care or network status or coverage. Now, what we're hoping to not hear is that Carson Tahoe and Carson Medical Group do not come to an agreement with Hometown Health and Senior Care Plus. If that does happen, that means that their services will be out of network starting July 1st. Now, that's a long way away. It may sound like it's not, but July 1st is about 2 weeks away. And when you're dealing with contract negotiations at this high of a level, every day is a lifetime. Now, we've talked to both parties, Hometown Health, Senior Care Plus, as well as Carson Tahoe, and we're hearing really good things. They are both coming to agreements on certain aspects of the negotiation, and we're hoping that the entire contract itself is accepted upon effective July 1st. Now, you may be wondering, why is it that I keep hearing about Matt talking about contract negotiations? We just did videos last month about United and Renown and their contract dispute. Unfortunately, that contract negotiation did not go the way we wanted it to. But we are very confident that this one with Carson Tahoe, Hometown Health, and Senior Care Plus will be fruitful. All of these entities are located here in the Northern Nevada area and realize the importance to the local community. The problem is that COVID-19 has been affecting us all for years, and it may be going away and we may not be wearing face masks the way that we used to, but healthcare in general is still being affected by COVID-19. In general, it takes about a year and a half to 2 years for a major claims incident to affect an insurance company or a provider group. So what does that mean? That basically means that here in the next year to 2 years, we're going to see insurance company contracts with provider groups being negotiated just like we're seeing today. It doesn't mean that everyone's going to be out of network. It just means that with a different financial flow in the healthcare world, there are going to be new contracts in place with insurance companies and provider groups. So what is next in this process? The next steps is to sit back and wait. There is nothing to do today, and hitting the panic button is just going to make things worse. We still have a few more weeks to get a good update from both groups as to a continued contract or a loss of contract. We're going to post a video here in the next few weeks or in the beginning of July discussing the final resolution of the contract. I recommend hitting the subscribe button on this YouTube channel to stay up to date with our next video, as well as any other updates we have in general in Nevada. Now, once again, my name is Matt Law. I work here at Health Benefits Associates, and thanks for tuning in.